Dr. Tom Roselle live right now, 630 WMAL.
I want to talk a little bit about whiplash, car accidents, things that happen out in the streets, and it doesn't take a whole lot. It can just be your little rear end or a front end or a side condition. It can cause you something called GERD, not just pain in the neck or headaches or anything else, but GERD, gastroesophageal reflux disease. Why? Because you got to remember that you're wired neurologically to every organ in your body. Now, the stomach has several different neurological inputs. One comes from the lower portion of the brain. This long nerve goes right down through your neck and attaches to the stomach, and then the nerves from the middle of your back go to the stomach. In a whiplash injury, the vagus nerve, this long nerve from the brain to your stomach, and the middle nerves, the splanchnic nerves from your back that go to the stomach, can be irritated. They can have pressure on them. They can be overstretched. And guess what happens? Your stomach goes into overreactive time, or it shuts down completely. And now over a period of time or days, you end up with a burning, you end up with irritation, you end up with pressure, you end up with the inability to digest your food, all from a simple car accident. That vagus nerve is a very important nerve while we're talking about it. It's the longest nerve in your body. It starts in the brain, just about the brainstem area, comes all the way down. It touches not only the stomach, but before that, the heart and the lungs, the large intestine, the bladder, and it can affect any of those organ systems all the way through. So when you look back and you see that you've had a little bit of a car accident, then you look at the history and you say, God, I've had problems digesting my food since then. Isn't it interesting that it may have come from that? And if it is from that, then you need to have good manual care, chiropractic care, to relieve the neurological pressure, osteopathic care to relieve the neurological pressure so your body can function optimally and get rid of the problem that it normally would have. We see so many patients that come in and they say, well, yeah, I was in a car accident about 10 years ago, but, I don't understand why that should give me a problem. And it was only about 10, 12 miles an hour. Well, 10 to 15 mile an hour impacts. 10 to 15 mile an hour impacts are the worst ones because there's the body can't compensate for it. Your car has not taken the blow. You've taken the blow. So the impact goes immediately. You haven't been able to brace yourself. It's not a happy thing, but it comes at a cost, and that cost is stomach problems, digestive problems, lower intestinal tract problems, and so forth, and you can trace it. We have patients that after a car accident suffer rapid heartbeat. And sometimes it's just a fall. A fall is a whiplash. Sometimes it's, horsing around, with a playmate, when you were a child. Now you're an adult and you have much more of an issue. It's one of those things that we really don't put our fingers on. For whatever reason, medically, they don't understand the normal physiological pathways that occur neurologically. The nervous system is king. It's incredibly important relative to how the body develops itself. And when you look at the brain and the spinal cord and you look at the nerves that go off of it, suddenly you said, wow, this is something that can make a huge, huge difference. Trauma. And I want to talk a little bit about that because it's such an important aspect of our lives that we're not even aware of. It comes from many different pathways. Did you know that if you just went to your dentist, and you've heard me say this before, but I want to specifically talk about this in relationship to what we just said about GERD, because in a whiplash injury, you have trauma to your teeth and you have trauma to your jaw, but also in a whiplash injury, you have problems as it affects the teeth structure, the TMJ, and subsequently the stomach as well. So here you go. You hit from behind. Your jaw goes into a clench position. Your TMJ jams the cranial structures, the skull bones, and now it acts as a irritant to the nuclei where the nerves come from. And then subsequently the nerves all the way down are irritated and stimulated. In my book, health is a do-it-yourself problem, I begin to unfold that structural portion, and I begin to tell you how that happens. And it's really important that you understand that, because there's so much that you can do for yourself. There's so much that you can turn around. And you need to be educated. You need to realize that that small things make big problems when we ignore them. That small little situations develop over time into enormous conditions where your body's immune system is depleted and challenged. So subsequently, you have to understand that the structural, chemical, emotional pathways are critical, and that's what we're talking about today. If you've listened, we started out with chemistry. We talked about the multiple vitamins and why they're necessary. We talked about a few other biochemical pathways. Now we're talking about the structural components. You ever know what it's like when you're hurting and you're feeling really, really bad? You emotionally feel bad too, don't you? You're just kind of depleted all over the place. You know, you don't want anybody to talk to you. Your energy's low. You're at, they say low ebb all the time. Well, there's a reason, because your serotonin dopamine mechanism has also been altered. That's your happy juice. That's what keeps you going. That's what keeps you on target all the time. And so we have all three sides of the triangle that are constantly being affected. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're at 888-630-WMAL. We're going to go to the phones. Many of you have waited to the end, and we've got several calls. I'll take several of you off the air, but I'll try to get to you on the air as well. Diana, how can I help you?
Oh, thank you. I had a bone density test that showed I had osteopenia.
Okay.
And the doctor put me on 50,000 milligrams.
Once a week?
Twice a week.
Twice a week, wow, okay.
Twice a week. All right. I went to an orthopedic doctor then, and he sent me to an endocrinologist who also specialists in bones. And he told me not to take the 50,000 twice a week, and he put me on Actinol once a month and said all I needed was 800 milligrams a day of vitamin D.
They're both...
So I'm very confused.
Diana...
Now, I had a blood test done,
okay.
And it showed something like 86 or 87, and that I had enough vitamin D in my system and I had enough calcium in my system.
Okay, you're not absorbing. So here's the deal. If your vitamin D level is at an 80 or more, you've got adequate amounts available, but it's not transporting. So that tells you that you have an inflammatory level that's too high. By the way, both of your doctors that told you what to do are wrong. Neither one of them are going to be effective. Actinol is actually going to cause your bone to be dead, and it'll break over time much more rapidly than taking nothing. The 50,000 units of vitamin D twice a week is too much for your body to handle ongoingly, and it's a synthetic form of vitamin D. It's not vitamin D3. So if you needed vitamin D, which apparently, according to what you're telling me, your blood levels are normal, then your vitamin D3 level would be about 10 to 12,000 units a day to get it up to normal levels, but your levels are normal. So that tells me that it's an inflammatory process and you're not absorbing it. So you have to find out what the reason is that your inflammatory levels are high. There are many things. I would have to know much more about you to be able to tell you what to do, but you have to get the inflammation down to be able to absorb the vitamin D. Diane, if you have other questions in this, we could talk about this the whole program. What I'd like you to do is contact me at rosellecare.com, and I'll get back to you immediately, and we'll discuss this further. I wish we had a whole lot more time, but unfortunately we don't. I have several calls, and I will take the time to answer you as soon as the program is over. I will stay here, and we will discuss what you need to discuss. So don't go away. Stay on the line. Don't drop off, please. We want to remind young runners, or any runner that is a female, that you may be losing folic acid by the bushel loads. And young women, particularly if they've started running early, many of them have altered their menstrual cycles, and they go into amenorrhea where they're not having cycles, and it's because their folic acid level is lower than what it should. There was a study that was conducted at Medical College of Wisconsin in Milwaukee, where they gave young women 10 milligrams of folic acid for 4 weeks and dramatically normalized blood supply, and then the women who were amenorrheic after supplementation turned around and they started their menstrual cycles. It's significant. Folic acid is very, very important when it comes to cardiovascular health and other autoimmune functions within the body. So, ladies, you need to make sure that you're taking adequate amounts of folic acid. 400 micrograms a day is not enough, and you have to combine it with vitamin B12. It's an important combination, and you have to take both at high levels. Vitamin B12 is something that is critical in decreasing inflammatory responses across the board. I'm here every Sunday at 12 noon, bringing you the most up-to-date information as we possibly can on your ability to take care of your health. You have control. This is Dr. Tom Roselle. See you next week. Bye.